Okay, Jess, patient assessment, trauma. You have 10 minutes to complete this. Do you have any questions?
No questions.
Okay, you are dispatched to Dirty Ernie's bar for a bar fight. PD's on scene.
Okay. BSI, is my scene safe?
Yes.
All right. Is this my only patient?
Yes.
Okay.
So PD comes over to you. They say that this gentleman was involved in a bar fight. He had multiple assailants, and he's pretty beat up.
Okay. All right. I'm going to request additional EMS at this time. And I'm going to consider C-spine for my patient.
Okay. So you walk up on the patient. He's laying on the ground. You notice his face is pretty bruised up. His shirt's been torn off, and he has what looks like has a footprint on his chest.
Okay. I'm going to check responsiveness of my patient.
He's really responsive to pain.
To pain. Okay. I'm going to say this is my general impression of this patient is poor. I think it's a good idea to get going quickly.
Okay.
So at this time, I'm going to treat any life threats. Do I notice any obvious bleeding, anything?
No.
Okay. All right, so I'm going to start with my airway. Open the airway and see, is there any obstructions or vomit or secretions in the mouth?
No, it's clear.
Clear? Okay. Breathing, how's my patient breathing?
You notice unilateral chest wall movement. He's breathing kind of shallow
Okay.
at 8 times a minute.
Okay, I'm going to have my partner assist ventilations with BVM, and I'm going to listen to lung sounds here.
Okay, you have absent on the right,
Okay.
diminished on the left.
All right, I'm going to go ahead and say this is going to be a... So we're going to go ahead and do a needle decompression on him. So I'm going to go ahead and dart the right side, and to relieve any pressure. Do I get a...
Yeah, you get a large rush of air sound.
Okay, I'm going to secure that in place, and then I'm going to reassess the breathing. Did that help?
Yeah, now you have diminished and present lung sounds.
Okay, diminished and present lung sounds. Okay, all right, that's going to be secured in place, and I'm going to continue on with my ABCs. Circulation, what's my patient's skin color, temperature, condition?
He's pink, warm, and dry. No major bleeding noted, and pulse is fast and regular.
Okay. At this time, I'm going to go ahead and treat for shock, give a blanket and high flow oxygen by non-rebreather mask.
Okay.
So then I'm going to go ahead and make this is a high priority transport. We're going to get them to the hospital as soon as possible. So now I'm going to get my partner to get a sample history and OPQRST.
Okay.
And my other partner is going to get a set of vitals on this patient. What are the vitals?
He has a blood pressure of 100/60. Pulse is 110 and regular. Respirations are 10 a minute. Anything else you want to know?
Yeah, can I get a blood sugar as well?
It's 100.
100, okay. All right, I'm going to get my partner to get 2 large bore IVs bilaterally.
Okay.
And I'm going to continue on with the secondary assessment. So I'm going to start palpating the head. Do I feel any trauma? Do I see any decap BTLS? Anything notice when I palpate the top of the head here?
You notice that he has a pretty large hematoma right side of his head.
Right side of his head. Okay, I'm going to check his eyes. Are they pearl?
Yes.
Okay. Do I see any bruising around the eyes or raccoon eyes?
He has a pretty good black eye.
Okay. I'm going to look in the ears. Do I see any fluid coming out of the ears
No,
or battle signs?
They're clear.
Okay. I'm going to palpate behind in the neck. Do I feel any step-offs or anything there?
No.
Okay. Reassessing the airway clear and patent?
Yes.
Okay. Any instability or anything like that?
No.
Okay. Since this patient's unresponsive, I'm going to make sure to put in 2 MPAs and continue ventilations by BVM.
Okay.
Okay, so I'm going to open up the Expose my patient. I'm looking for tracheal deviation or any JVD. Do I notice anything?
You have JVD.
JVD, okay. All right, I'm going to palpate the chest. Do I feel any
You
flail
feel a little
segments?
bit of, no flail segments, but a little bit of crepitus on the right side.
On the right side? Okay.
Yeah, not flail.
Okay, any bleeding or anything?
No.
Okay. I'm gonna palpate the abdomen. Any distension, any rigidity?
You see a large bruise on the left side, left lower quadrant.
Left lower quadrant, okay. Pelvis. I'm gonna push in and down. Any instability in the pelvis?
He's stable.
Any priapism?
No.
Okay. Gonna palpate the legs. Notice any decap BTLS in the legs?
No.
What about pulses? Am I getting good CMS in
Yes.
lower extremities? Okay. I'm then going to check the upper extremities. Any decap BTLS there?
Nope, they're clear.
Okay. CMS good?
Yes.
Okay. Moving on. I think treatment for this patient is high flow oxygen. Patient, I think, is the patient getting any changes in responsiveness or anything like that?
No.
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 Okay. And vital signs. We're gonna go ahead and give some fluids, 20 ml per kill for this patient, and we'll go ahead and rapid transport and get him to the hospital.
How are you going to transport? How are you going to get him to your stretcher?
So we would put this patient on a fully mobilized on a backboard seat collar, and we'll put that on the stretcher, and then we'll rapid transport with that. Also, I would be reassessing all my interventions. Check constantly, paying attention to the patient's breaths to see if that is if the needle decompression is still viable, and that we're not continuing to get worse there.
Okay, he's holding.
He's holding. Okay. Reassess vitals every 5 minutes, and then I'm done with this patient.